Individual Service Fund, established under the Care Act 2014, provides a means for individuals in England requiring care and support to have more control over their care arrangements. To achieve this, local authorities evaluate an individual's requirements and assign a budget accordingly. However, with individual service funds, individuals or their representatives can choose a provider to manage their budgets. In a recent report by the King's Fund, it was discovered that the number of people using individual service funds, also known as ISF, in England has now grown significantly. And with this increase, there's a growing need for innovative approaches within the domiciliary care sector. Welcome back to the Health and Social Care Business Podcast. And today we are focusing on an emerging commissioning process called individual service funds, also known as ISF, and its potential to empower domiciliary care providers. And joining us today to shed light on this topic is an advocate for change. Chris is the founder of Self-Directed Futures, a social enterprise committed to a global cause with the aim to foster a world where every individual matters. Alongside his associates, Self-Directed Futures has extensive experience in enhancing health and social care systems, specializing in commissioning, brokerage, training, coaching, and the practical implementation of ISF, which is the topic we're discussing today, as well as collaborating with local authorities, clinical commissioning groups, and support provider organizations, offering a range of expertise to develop co-produced change programs that yield excellent outcomes. Chris, we're delighted to have you with us today. Thank you for taking the time to be here.
Thank you very much for inviting me along. Great to be here.
Brilliant. Okay, so Chris, to start, could you briefly explain individual service funds for our listeners who might not be familiar with them?
Yeah, sure. So basically, everybody who has support funded by a local authority or potentially an ICB has either a personal budget or a personal health budget, depending on who the funder is. And that personal budget can be taken as a direct payment, or in the old days prior to individual service funds, it would have been a commission service. But individual service funds sit in the middle of that. So basically a provider is the simplest way to understand it is probably a provider held budget. But instead of it being locked into a number of care hours or locked into sort of time and task based activities, it's just it basically becomes converted into a fund that the support organization that's holding that fund can work with the person they're supporting to decide how best to use that fund, basically. So it's decoupling the budget from time and task based support hours and just making it a budget that's then linked to the outcomes and the goals that a person wants to achieve.
Brilliant. So Chris, you have in-depth knowledge of how the social care system works, and that makes me so happy to have you on here, seeing as we've both worked as carers and have been in the caring business and have seen rather how the caring business has evolved over the years. Now, in what ways would you say the ISF system makes the caring job more flexible than it was years ago when we both worked as carers? I know previously in your description or your definition of what ISF is, you made a reference of moving from time and task to innovation. So I absolutely love the ISF model. I feel this is the future of domiciliary care. Personally, I think it's the best. Obviously, some service providers or some service users may not be able to use this, but for people who actually have choices, this is the best. It works best for both providers and the service users as well.
Yeah, so I guess like you, I mean, I started off my career working in care, and and ended up eventually working in commissioning. So I've straddled the both sides of the system, if that makes sense.
Yeah.
And one of the things that I think, working in care, we were delivering hours of support to people, and there was always an assumption that the support worker was almost like a jack of all trades, and we were going to be able to do everything, So be taking people shopping, be helping them with their support, their personal care, be helping people learn new skills, learn how to cook, learn how to use gym equipment, taking people down the gym, all that kind of stuff. I would say probably I'm not the best qualified person to teach people how to cook. So the difference for me with an individual service fund might be that somebody could convert their care hours into a small budget to then go to have cookery lessons. or perhaps could use some of their funds to go towards the cost of a Green Chef box to be delivered, so they can put all the ingredients together themselves and produce that. So that's very simply an example of, for me, something where perhaps I, as a support worker, didn't necessarily have the right skills to really teach somebody something.
Yeah.
With an individual service fund, they have the opportunity to take what would have been those 2 hours of care, convert that into, 30-40 pound budget, and then use that budget differently. So another good example of that would be, I'm quite into fitness now, but perhaps I wasn't so much when I was younger.
Okay.
And I often worked with people who wanted to learn, go down the gym, they wanted to learn how to do the gym equipment, but actually I probably wasn't the person for that either. The best person to do that job would be a personal trainer, or somebody who worked at the gym who could perhaps spend an hour or two with that person and take them through some structured PT sessions, basically to help them improve their health. So rather than me trying to do that as a support worker, and I'd happily throw myself into that sort of stuff, I'd do the best I could do. But actually what I would do now would be take that money again, take perhaps the 2 hours that I would have spent with that person, convert that into a fund, and then that fund would then go to pay for a personal trainer for a 2-hour session with that person, who'd probably be much better at helping them understand how to use the equipment, how to do the exercises, how to think about their nutrition, all of that kind of stuff, basically. So in simple terms, I think it's just a way of enhancing the level of support that people have, and also probably tapping into the self-employed workforce has really grown over the last few years. Self-employed care and support, and being able to just tap into sessional support from people, and just be able to buy sessions, to use that funding for people to perhaps join a club or do an activity. So, but not all of it having to be done by me as the support worker, if that makes sense. It's really broadening people's range of options.
Yeah, because sometimes you have, for example, like a 2-hour call, and it's to support with lunch or things like that. And tasks like that could maybe take about 30 minutes. And then you have another hour and a half left. And what you're supposed to do in those hours, according to the care plan, is to keep the service user company. But in that time, we could be doing other things, like the example you gave about actually getting food that you could actually cook yourself. So if you actually maybe use HelloFresh, for example, in 2 hours, you can actually assist them, enabling them to be promoting independence as well. You do the cooking, you observe their feeding if they need support with that, and the whole process, 2 hours, and they've learned a skill, they've promoted their independence, and it's just a very personalized support. Another reason why I absolutely love it. For this service, because I know we're talking about dom care today, but this also would be very applicable in supported living settings as well, wouldn't it?
Yeah, it works brilliantly. It works brilliantly in all settings, to be honest with you. But obviously, it does work very well in supported living, and the individual service fund itself, the idea for it, that's where that was pioneered, basically. So Scotland, they originated in Scotland, and they've been built into the Scottish legislation very strongly as a result of that. But it was very much pioneered with people with autism and autistic people, because they often had quite big budgets and possibly were at much greater risk of, exclusion from the community. So that was a way of then helping explore all of those avenues to help people get better integration into the community, basically.
Oh, brilliant. How does the use of individual service funds differ from traditional models of domiciliary care? I know we've spoken about this again in the introduction. Perhaps we can go into it in a bit more detail.
Yeah. Well, again, it's the concept of just having if you're supporting somebody, they've probably got a list of goals that they want to achieve in their lives. And traditionally, you'd have been given the funding to provide a worker to do those tasks with that individual to do those goals. But now you're able to convert that fund into just a budget to potentially buy stuff on their behalf. So examples of that we've seen that I think are incredible. Stuff like people who've been using perhaps a day service and decided that they don't want to go to day service anymore. They've put their budget together with a friend, and then they've rented an allotment, and then they've obviously used their budget together to pay for a worker to go with them to the allotment. So they've basically jointly buying stuff in a way that perhaps people haven't been able to do before. So that's been good. We're seeing a little bit of use now around personalized technology. People buying, for example, there's a product called Memo Planner, and it just helps people organize their day, and it can be used to replace staff time. And basically, there's a subscription, you've got to pay for that, you've got to pay for the equipment. But again, you can take that out of the individual service fund budget, and basically use it for bits of technology as well. We've seen use for people using hypnotherapy, potentially to help them with managing their weight, or perhaps weaning off smoking, or health and well-being goals. Again, that stuff as a support worker, I wouldn't have been able to do that. I couldn't advise you on nutrition. I can, barely kind of get nutrients into myself. So that kind of stuff. So it's allowing people to use it more flexibly. And we see a lot of stuff. We've seen stuff around people having sleep-ins where they could just flex their sleep in every night if they needed one or not. And the money stays in the pot. Sometimes it's just having a contingency fund. So basically it gives people a peace of mind that they know they can use it to buy the support when they want it, but they don't necessarily always want it at prescribed times. So the big difference for me with a lot of this is actually just people being able to agree with their support organization when and how they are supported. And it's really simple stuff, and being able to say, well, actually, I don't need support today, but what I'd like to do is have twice as much time with you tomorrow to go and do something else that's important to me. And for you as a support organization to have the ability to do that, to be able to listen to the person you're supporting and actually create that flexibility in a way that works, because we want the best for people. We want to help people get better lives. And I certainly felt frustrated in services that it was too rigid. We were often too rigid, and what we'd been given for people was too rigidly set. So obviously this is the opportunity to basically create a bespoke arrangement around somebody.
Just to add to what you've said, I remember when I was working as a manager for a dom care company, sometimes when you have conversations with the service users, they do want to do all these extracurricular activities, but because it hasn't been approved already, it's difficult to do it. And then if you did do it and then you go above the hours, then you have to then go back to the social worker, and then you have to then defend why you had to go over. And then if it wasn't in the pre-assessment, then you may not even get back the funds. So that's, again, another reason why this model is very good and why dom care providers should look into using it and learning how it works. And just to also clarify also the different models. So usually or typically once the assessment has been completed, they go into a procurement system and then send out messages to all the providers that have been successful on that bid. And then they say to them, this is the budget, go ahead and create a care plan. So it's not really, even though, yes, the care plan is created with the service user, it's still not personalized. But with the ISF, as opposed to saying, go into the portal and finding the preferred provider, the choice is on the individual to actually find the provider. Am I correct in saying that?
Absolutely, yeah, spot on. So if you looked at another key difference is instead of going through that council commissioned route where you go through perhaps sometimes electronic portals and people don't necessarily even choose a support organization, down the individual service fund route, basically the council should create a list of individual service fund provider organizations, domiciliary care providers, supported living providers, whatever it is. And that list should be given to people to basically choose their own support provider from. So that's a key difference within, with this model. Basically, there is more choice and control, even down to just who actually provides your support.
Yeah, brilliant. Can you elaborate on how? So, Chris, you founded Self-Directed Futures, a social enterprise dedicated to empowering individuals in social care through initiatives like the individual service funds. Can you elaborate on how Self-Directed Futures has specifically contributed to improving the utilization and effectiveness of ISF within the domiciliary care sector?
Yeah, sure. So my background in care and spending that time delivering support to people and seeing, and I've worked in supported living, I've done some outreach stuff, I worked as a self-employed personal assistant, I'd done quite a range of different things, and a lot of those tasks were very bespoke as well around individuals. And then moving into commissioning, I found the commissioning world was very rigid and very, very structured. And again, it was very process heavy. And it felt like we were often really making decisions on behalf of people. And who are we to be making those decisions? Because actually it's not our care. So my mission in commissioning was to try and look at systems and processes and how do we then empower people to have more choice and control, more flexibility. And so I spent some time in commissioning doing that. And I set up individual service funds at Dorset Council. It was quite a few years ago. That's how I got into it when the Care Act came out. And then as a result of that, it was a bit of a eureka moment. It was a bit of a, well, this is perfect. I'm hearing some incredible stories from people about their lives. I know that people are taking control. They're choosing their support providers. We're getting great quality support organizations into the area that are wanting to work in this way. I want to do this for a living, rather than just a piece of my job. I wanted it to be my whole job. So so I came out and set up Self-Directed Futures, and I just over the years have been lucky enough to work with some just brilliant people. And I was able to sort of collate them together and say, hang on, look, we all believe in this. Let's see if we can go and change the world a little bit and try and get some councils excited in the possibilities here of individual service funds, because at that time they'd been around for about 4 years, and there wasn't perhaps much traction in terms of lots of authorities doing this work. So we got together, and obviously we go around the country and persuade local authorities really of the benefits of individual service funds, and then we give them technical advice and support around how to then do the commissioning bit. But we also provide training and support for support organisations who are going to be offering the individual service funds, because it is a very different way of working.
Yes.
So a lot of our work really recently is we've sort of had to unlock the local authority to be able to feel confident to offer ISFs.
Yep.
And then we need to work with the providers in that area to help them feel confident to deliver ISFs. And it's basically trying to bring everybody together, a partnership arrangement between the local authority and the provider, and everybody feeling confident that they've got the right skills and they're able to work in the way that makes sense, if that makes sense.
Awesome. So if there's a domiciliary care provider out there listening in and they wanted to provide ISF, or if they wanted to provide ISF brokerage, they should reach out to you.
Yeah, I mean, basically all we do is we just, again, we're consultancy, but we're a funny bunch because we all have lived experiences of doing what we do. So in our network, it's providers, we've got family carers, people who've lived the experience. So we just connect people up. So we've got providers who are doing ISFs, and we then connect other providers to those organisations, and we help them share the learning and basically share some of the practical support around that. So we're really passionate about networks. We run a self-directed support network around England. The people that's free to join, and people can just come in, and it's other providers who are doing individual service funds, and anybody's welcome to join that who wants to get involved in working in this way. And we also run a network for commissioners as well to help them sort of become more comfortable and confident in delivering individual service funds. So
that's awesome. Do you know how many local authorities are currently who have adopted the ISF model?
Yeah, we did a survey. We've done 3 surveys nationally so far, and in 2018 there was 2. In 2021, I think there was something like 9, and I think the last count there was around 23. But we've got 44 local authorities in our network. We know there's a lot more interest than there was. And I actually, if I'm honest with you, I don't think all of the councils responded to the survey, and I think some of the councils responded with the wrong response, because we were working with them saying that they weren't doing ISFs, and we were like, well, we know you are. So somewhere along the line, whoever replied to the survey didn't necessarily get it exactly right. But I'd say maybe 25% of councils, 25 to 30% of councils in England are in some way active and at least exploring it, if not delivering it.
That sounds right, because I believe there's about 317 local authorities with 316.
Yeah, that's right. If you take out the districts, because they don't have the social care responsibilities, it's about 174 councils. So
commissioner listening and who wants to adopt this as well. So there's obviously more work to be done in terms of raising awareness of ISF and people adopting this method of delivering care as well. So have there been any particular innovative approaches or best practices your organization has championed to yield positive results for both service users and care providers? I know you mentioned previously about give a few examples, but if you could just go into it a little bit more specific approaches that stopped with you.
Yeah, no, sure. So we've done quite a bit of work over the years helping people come out of hospital, have been perhaps stuck in inpatient services long term under the sort of transforming care agenda. So autistic people and people with learning disabilities. And so we've done some.
That's a huge problem that you solve.
Yeah, no, absolutely. Yeah. So that's been really creating bespoke ISF arrangements that are just budgets that are created entirely around a person, that putting into the budget the amount of training that the team need, putting into the budget salaries for the workers that are perhaps above the market rate, so that people can get access to and have reliable support in their team, paying family members, looking at using creative solutions for property, bridging funding to rent places. People use caravans. We've had all sorts of just anything you can kind of think of that might be a way of solving a problem for somebody to help them move out of hospital. We've looked at using the budgets creatively. That's been really nice, and there's some great examples. And we're talking people, sadly, have been stuck in some of those inpatient units for 7, 8, 9 years. And with this approach, we've helped them out of hospital in 6 months. So because often the blockers are, it's people can find solutions, but they don't know how they can then fund those solutions. And
Yeah.
the ISF provides a platform really for that kind of creative thinking.
So did you have to work with the discharge team at the hospital, or did you have to work with the service providers, or both?
It's both. It's really a partnership. It has to be done in partnership because both parties need to feel safe and happy, and the person needs to
Yeah.
feel safe and happy. So it's always a partnership, and that's the biggest learning point for me with this really in terms of innovation. This is really about enabling your support provider organizations to work as trusted partners in arranging someone's support, and that's really the big key takeaway from all of this. Is it's organizations who want to work in this way become partners of the local authority, and so we often have conversations about, well, it's like counterintuitive to give away part of a budget for somebody and give away their support hours to reduce the income from a care provider, but the local authority obviously loves that, and so do people and families. So we've seen some organizations exponentially grow because they're working in this way, because it's what people want, and it's what commissioners want, and it's what social workers want. So for me, that's the beauty of it, really.
Yeah, I understand the concern of giving the care hours away, but for example, obviously someone requires personal care. It's saying rather than just giving limited hours just to provide that service, but doing that in addition to other things that would make their life a lot more
meaningful and rich,
meaningful.
I guess.
Yes, thank you, Chris. Absolutely. So while the individual service fund offers flexibility, are there any challenges that dom care providers face when implementing them, and how can these challenges be overcome?
Do you account for and manage people's budgets?
Yes.
Because remember, most care organisations are very used to doing rotas, holding money, receiving money, but it's invoiced, it's the care provider's money.
Yes.
Now we're saying you're holding that person's budget and you can invoice against that budget, but you have to hold and keep transparent how you're using that funding. So that's challenge number one. One of the solutions we advocated a few years ago, we came across an organisation called People Places Lives, and they run something called Virtual Wallet, and that we have now worked with them to develop something called ISF Wallet, which is just virtual wallet but for providers.
Yes.
Rather than
I think
councils.
we spoke about this last year, actually.
Yeah.
Remember?
And again, it's just an accounting system that organisations can use to hold the person's budget. So there's a problem around like how do you scrutinise and have overview of all the people you're supporting and all of their budgets. But the solution is to look at software products and platforms to help you have that overarching understanding of each person's funds and what they're being used for. So that's number one challenge. Number two challenge is probably social workers feeling happy, understanding what ISFs are and feeling confident to move away from time and task and to be less prescriptive in the support planning. That's an ongoing challenge. That's an ongoing challenge.
I can imagine.
And it takes time for trust to build up, because support organisations have to really, I guess, get the trust of social workers by proving that they're really creative, by proving that they're person-centered and that they want to work in a different way. And I think that then is a positive reinforcement when that does happen, that social workers then can then relax about some of that stuff. So that's a challenge.
Yeah. And then also proving that it's yielding positive outcomes as well.
Exactly. Yeah. So where it works really well is where you've got I've worked with social workers who are really very nervous, I would say, about individual service funds, and then after a couple of years I've had them come back and I've found out that they're now champions for individual service funds. But that's because, and again, credit to the care providers, because it's about the care providers making it real. An individual service fund is just a lump of money. It's the care provider working with that person to figure out how to creatively use it. That's what creates that rich tapestry of solutions around the person. So the other bit we do is, and the challenge is helping care providers feel secure about decision making around the budget. So that's the other bit. And the solution to that is we provide training and support around the Care Act and helping providers link together the decisions around the use of the funds back to eligible needs and the Care Act. So that's, in simple terms, that's where it comes back to care providers becoming an extension of social services, almost like a social work assistant.
Yes. And all of this information can obviously be found on your website for providers who are interested in going down this route.
Yeah, it's on our website, and we did a paper of skills for care about individual service funds in the workforce. So I can share that with you, and we can perhaps pop a link somewhere. But yeah, it's on the Skills for Care website as well. So
brilliant. So what role do local authorities play in supporting dom care providers utilizing the individual service funds effectively? So I know you mentioned the wallets, which that's how they could actually use it to monitor, measure, but with regards to, and you mentioned trust as well, was there anything else? What role do they actually play?
Oh, I think the local authority is really critical to this, because their role really within this is to collect together organisations who want to work in this way. And that the first part of the mission for a local authority is to talk to their local market, talk to the providers locally and say, hey, look, we really want to offer this. Who's interested? Who wants to come and play in this new world of individual service funds? And maybe, it's not for all organisations. We don't usually see everybody getting involved in this. We see a few organisations, usually in most areas, who are really passionate about the idea of personalisation and who want to try something different.
Yep.
So the local authority's job, I think, is to get those organisations together and then really co-produce stuff with them, like co-produce what a good ISF should look like with those organisations, co-produce with the people in that area, citizens in that area, what they think a good ISF should look like. Talk about funding, talk about the fee, any management fees for an individual service fund. Talk about it with the providers locally, because if you don't talk to the market, how do you know if what you're putting out there is enough money financially to make it work? So it's got to be a partnership arrangement. So the local authorities have a really big role in just working with local organisations to help them understand what individual service funds are, and then working with their own workforce. And I'm thinking about the social work teams here particularly, so that they understand what individual service funds are, and that people understand that they need to change how they do support planning to move it away from time and task and move it towards budget and outcomes.
So where does best interest and mental capacity fit in this? Because there's an element of financial control and there's risk of financial abuse as well. Yeah. So where does that fit in this?
Yeah, no, absolutely it does. Yeah, I mean, in many ways, individual service funds were invented probably for people who weren't able to take a direct payment because they didn't have the mental capacity. So therefore, decisions around the person with an individual service fund are all done through best interest, if they don't have capacity to manage their own budget.
Okay.
In a way that you don't really see direct payments being offered to people who don't have capacity.
Yes.
Unless if they have a suitable person, then that person can act on their behalf. But that excluded quite a lot of people from having personal budgets, really, or having a personalised approach to their support. So individual service funds work within the framework of the Mental Capacity Act, and decisions around the person, starting from, do they want an ISF? That would be a best interest decision. Which support organisation is going to hold their budget? That would be a best interest decision. Signing off the plan around the person? That would be a best interest decision. So once the provider's got the budget and done that planning, they would come back in the circle of support. Would be a best interest decision to sign that off. So Amazing. It can all operate underneath the auspices of the Mental Capacity Act, basically, which is why I'm really passionate about it, because it means it opens up personalised working to a whole group of people who potentially were excluded from taking direct payments.
Yes, agreed. So reports such as the King's Fund highlights a significant underrepresentation of younger workers in social care and exposes challenges in recruitment and retention. However, some providers acknowledge the benefits younger staff bring, such as tech skills, which we made reference to earlier. Considering the fact that the individual service funds can potentially empower service users to choose more personalized care approaches, do you see any ways the individual service funds could be used to create more attractive work models, rather, for younger people in dom care?
Yeah, no, 100%. Yeah, I do. And I think even down to, being able to use the individual service fund to buy in sessional support from somebody who's perhaps a personal trainer. Maybe you don't need to have a younger worker, you just need to have a personal trainer who's fit and wants to take you for a run every day or whatever it is. So it's about creativity around that. But we know anecdotally from organisations doing ISFs that they're seeing quite a good recruitment and retention sort of cycle because of the ISFs. Because I think it's just a really nice, values-driven, personalised way of working. And I think a lot of people in the sector, I know we talk about paying conditions a lot for the social care workforce, but it's also about values. And I think a lot of people are in this work because they enjoy the work, they want to improve people's lives, they want to help people. And an individual service fund unlocks some of that creativity, and staff can have an idea. Well, what about an Apple Watch for somebody so independently, that kind of stuff. It just opens up these avenues for creative thought that I think, for me, certainly organisations that have embraced this over the last few years, they talk very positively about the impact on recruitment and retention, because they're just living their values. And I think that's really, for me, that's quite powerful.
Absolutely, because obviously the younger workforce, they would prefer a more innovative approach. They want to try other things, and they would obviously, even the way the world is changing, and even to also provide services to the younger generation as well. The younger generations don't want the typical time and task. They also want to live their lives to the fullest. They have aspirations and dreams and ambitions that they actually want to achieve. So this model allows for that, and it allows for younger people to come into the sector and make it happen. So in your opinion, how can the ISF be further developed to best support both dom care providers and service users in the future? And are there many resources you would recommend for our listeners who want to learn more about the ISF?
Yeah, so what we'd love to see is every council in England offering individual service funds. We would love to develop a map of England where people can go, citizens can go and see that their local authority offers an individual service fund, but also see which support organisations offer individual service funds in that area. Because I think one of the problems with this is people aren't empowered with information, so they don't know to ask for individual service funds. They don't know which providers are doing ISFs. It's very complex for citizens really to navigate the social care system, as we know anyway. So we'd love to see more work done on creating a central resource where people can go and see, I'm down in Somerset. Well, which care providers could I talk to in Somerset that are doing individual service funds? So we're looking at creating a map resource for that. We would love support organisations to join our self-directed support network and come into that provider ISF forum and just and be part of that and talk to other support organisations, because that is a community of practice that is completely open to sharing. It's about partnership working, so all the organisations in that space are really interested in helping other organisations and elevating other people into that space to be able to provide individual service funds. So I'd really recommend the self-directed support network. And we can obviously share the links for that with you guys. Resources, as I said, the Skills for Care paper on individual service funds and the workforce. So I think it's called Developing the Workforce for Individual Service Funds. That basically summarises what a care provider needs to do to be able to offer ISFs and what they need to change in terms of their approach. Brilliant. So that for me is probably the ultimate resource, but there is lots of stuff online. Published via the Citizen Network, which previously was the Centre for Welfare Reform, and their CEO is Simon Duffy, who he's the president now, I think, actually. But he was the guy at Partners for Inclusion that worked to invent the individual service funds. So there's some great resources from lots of different people who've worked in that space of individual service funds, care providers, commissioners, people with lived experience, all published on that website. So if you want to go in there and hear stories, or you want to see like the practical advice on how to do it, it's all on the Citizen Network website as well.
Lovely. All of that will be in the bio, so anyone who's interested could have a look and you could have a look to see how you could be involved in it. On a lighter note, Chris, would like to end the podcast by asking what word of advice you would like to give to citizens who don't really know about ISF but would like to embrace it, and also to service providers who might want to adopt this model of care.
Well, I'm a really big advocate for individual service funds, and I think people should be knocking on the door of their councils and saying, hey, why haven't we got this offer locally if they haven't got it? And I think care providers should be agitating a little bit by talking to the people they're supporting and saying, hey, would you like an ISF? And if the answer is yes, then I think they should be getting together with the people they support and knocking on the door of the council and saying, hey, why aren't you offering individual service funds? So the biggest thing for me is to get as much noise as possible and positivity around the ISFs and ask councils to please make sure they're on offer for people, because we just know that there's not enough councils that are offering this yet for people. So so I think it's about empowering people to go and demand and feel more confident about asking for individual service funds where they are.
Brilliant. Thank you so much again for your time, Chris, and it's been an absolute pleasure. And hopefully, maybe in the near future, depending on how far you've gone with integrating more local authorities with the ISF, we could possibly have you back on board to talk about the progress you've made. So thank you so much again, and enjoy the rest of the day, because it's a sunny day today.
Yeah, it's beautiful. Thank you very much. Take care. See you soon.
See you soon.
Cheers.